I'm Dr. Ahmed Kazmi, and I am a UK-trained consultant dermatologist and GP, currently based in Australia. I am a general dermatologist, so I deal with all pediatric and adult dermatoses, but my primary focus are hair and scalp disorders and medical education. But I also have a special interest in psychodermatology, skin of color dermatology, small molecules, and transgender medicine. Research consistently shows that visible dermatoses cause significant psychological comorbidity, and this can manifest in several ways, including anxiety, depression, poor self-esteem, sexual dysfunction, maladaptive coping mechanisms, and sadly, in rare circumstances, even suicide. If you ask people the function of skin, they'll remember elements such as barrier function, homeostasis, vitamin D production, immunosurveillance, etc. But they'll often overlook that a major role of skin and hair in humans is actually adornment. And in almost all cultural groups, skin and hair serve important roles in sense of self, expression of self-identity, physical attractiveness, and I think it's this interruption in the psychosexual function of skin and hair that creates such a high psychological morbidity. So if you take, for example, a disease such as atopic dermatitis, which is characterized by itch, in this condition, you'll find high levels of anxiety and interrupted and poor sleep. And in younger patients affected by the disease, for example, you'll find poor concentration and even increased risk of development of ADHD. Other conditions, such as those characterized by malodor, such as chronic infected venous ulcers, can be hugely stigmatizing for patients and result in them becoming housebound and isolated. Whereas on the other hand, dermatoses which may be visually striking but relatively asymptomatic, such as alopecia universalis or severe vitiligo in a person with deeply pigmented skin, are likely to be associated with depression and altered sense of self.